Welcome to our lesson on delivering adverse drug reaction or ADR information with empathy and compassion. I'm here to emphasize just how crucial this aspect of patient-centered care is. First, let's talk about empathy in communication. Empathy is the ability to understand and share the feelings of another person. When we communicate ADR information with empathy, we show genuine concern for the patient's well-being. Imagine you're a healthcare provider and you're discussing potential ADR with a patient. Instead of just presenting facts, you take a moment to acknowledge their feelings, to listen actively, and to offer support. Emotions play a significant role when patients learn about ADR. Patients might feel fear, anxiety, or frustration. It's our responsibility to address these emotions empathetically. We need to be there for them, showing that we understand their concerns and fears and that we're here to help. Next, we have patient-centered communication. This approach involves tailoring our communication to each patient's unique needs and preferences. We recognize that not every patient is the same, and what works for one may not work for another. So we foster a partnership between the patient and the healthcare provider. Building trust and rapport is crucial. When we communicate empathetically, we establish trust. Patients are more likely to trust us and follow our recommendations, including reporting ADR. Trust leads to better healthcare outcomes. Lastly, cultural sensitivity. Patients come from diverse backgrounds, and we must respect and understand their cultural differences. By being culturally sensitive, we ensure that our communication is respectful and that information is conveyed in a way that respects their cultural beliefs and preferences. In summary, delivering ADR information with empathy and compassion involves recognizing the emotional impact on patients, building trust, tailoring communication, and being culturally sensitive. By doing this, we not only improve patient understanding, but also encourage ADR reporting and enhance the overall quality of care. Remember, empathy and compassion can make a world of difference in patient care. Explaining adverse drug reaction severity and management to our patients and their families. This is a crucial part of patient education and healthcare communication. Let's start with the importance of clear and understandable explanation. When discussing ADR severity and management, it's essential that we use plain language and avoid medical jargon. Our goal is to ensure that patients and their families can easily understand the information we provide. Imagine you're a healthcare provider explaining ADR to a patient. Instead of using complex medical terms, you choose words that are simple and straightforward. This approach empowers patients to make informed decisions. Next, let's discuss risk-benefit assessment. Explaining the severity of ADR involves discussing the potential risks and benefits of different treatment options. We should engage our patients in shared decision-making by presenting the pros and cons of various approaches. Consider a scenario where you're discussing ADR management with a patient. You take the time to explain the potential risks and benefits, considering the patient's individual health status and preferences. This collaborative approach empowers the patient to actively participate in their care. Informed consent is a crucial ethical requirement. When discussing ADR management, we must ensure that patients are fully informed about available treatments, potential side effects, and alternatives. This empowers patients to actively participate in their care. As a healthcare provider, you explain the available treatments, potential side effects, and alternatives to the patient. By obtaining informed consent, you respect the patient's autonomy and give them a say in their healthcare decisions. Providing patient education materials is another valuable tool. Written materials, such as pamphlets or brochures, can complement our verbal explanations. These materials should be clear, concise, and easy to understand, reinforcing key information about ADR severity and management. You provide the patient with educational materials that they can refer to later. These materials are valuable references, helping patients and their families better understand and remember the information. Shared decision-making tools are essential. These tools, such as decision aids or visual representations, can help patients better understand ADR severity, treatment options, and potential outcomes. You provide the patient with a decision aid visually representing ADR severity and various treatment options. This tool enhances the patient's comprehension of complex medical information, making it easier for them to make informed choices. Lastly, let's talk about support and counseling. Patients may experience anxiety or distress when learning about the severity of ADR and their management. We must be prepared to offer emotional support and counseling to address these concerns and ensure that patients feel heard and supported. In this scenario, you provide emotional support to the patient who is experiencing anxiety about their ADR. Your compassion and counseling help the patient navigate their concerns. In summary, explaining ADR severity and management involves clear communication, shared decision-making, informed consent, the use of supportive materials, and offering emotional support. These practices empower patients, improving treatment outcomes, and increasing patient satisfaction. Remember, effective communication is at the heart of patient-centered care, involving patients in treatment decision-making. This fundamental aspect of patient-centered care empowers individuals to actively participate in their healthcare choices. Let's start with the shared decision-making model. Shared decision-making is a model that encourages healthcare providers to engage patients in discussions about treatment options, risks, benefits, and their personal preferences. Imagine you're a healthcare provider discussing treatment options with a patient. Instead of making decisions on their behalf, you actively involve them in the conversation. This approach recognizes that patients are experts in their own lives and health. When involving patients in treatment decision-making, we must be sensitive to their cultural backgrounds and preferences. As a healthcare provider, you recognize and respect the patient's cultural beliefs and values. This enhances communication and ensures that the patient feels valued and understood. Effective involvement requires health literacy. It's essential that information is presented in a way that patients can understand. We must assess and address health literacy levels to ensure patients can actively participate in discussions about their treatment. You use plain language to explain complex medical information, making it accessible to the patient. This ensures they can make informed choices. Finally, respect for autonomy is a core principle. Healthcare providers should respect the patient's right to make their own decisions about their care, even if those decisions differ from the provider's recommendations. As a healthcare provider, you respect patients' autonomy and support their right to make decisions that align with their values and preferences. Informed consent and shared decision-making tools are also essential in involving patients in treatment decision-making. In summary, involving patients in treatment decision-making is a patient-centered approach that promotes collaboration, informed choices, and respect for autonomy. This approach improves patient satisfaction, treatment plan adherence, and overall healthcare quality. Remember, empowering patients in their healthcare decisions is patient-centered care's core. Involving patients in treatment decision-making. Ensuring clear and comprehensive adverse drug reaction or ADR reporting. This is a critical aspect of patient safety that requires our attention. Let's begin by recognizing the importance of ADR reporting. Healthcare professionals should emphasize to patients and their families just how significant ADR reporting is. After all, patients are the ones directly affected by ADR, and their insights are invaluable. Imagine you're a healthcare provider discussing ADR with a patient. You take a moment to stress the importance of reporting any suspected ADR. This proactive approach contributes to the early detection of potential medication-related risks. Next, let's talk about providing user-friendly reporting tools. Offering patients user-friendly tools and resources for ADR reporting can significantly facilitate the process. As a healthcare provider, you demonstrate how to use an online reporting platform, making it easy for patients to report any concerns they might have. Education and training are essential. Educating patients and their families about the importance of reporting and providing clear instructions can empower them to report ADR accurately. You educate patients about ADR reporting and provide them with reporting forms. This ensures they have the tools and knowledge to report any adverse reactions they may experience. Encouraging open communication is key. Healthcare providers should create an environment where patients feel comfortable discussing ADR openly. You actively listen to patients' concerns about ADR, making them feel heard and valued. This approach encourages patients to report even minor symptoms or concerns. Promoting patient engagement is crucial. Patients actively participating in their healthcare are more likely to report ADR promptly. You involve the patient in treatment decisions, making them vigilant about monitoring for ADR and taking ownership of their care. Timely follow-up is the final piece of the puzzle. Healthcare providers must ensure they follow up on reported ADR promptly. You investigate and document the reported ADR in the patient's medical record, taking appropriate action to manage or prevent future occurrences. In summary, ensuring clear and comprehensive ADR reporting involves educating patients, providing user-friendly tools, encouraging open communication, promoting patient engagement, and ensuring timely follow-up. Thank you for joining me in this lesson. Remember, by actively involving patients in ADR reporting, we contribute to better patient safety and improved healthcare quality.